everybody, Dr. Ziv Simon here, and today I want to address a topic that both patients and dentists find frustrating, and that is periodontal bone loss. And I know that you are diligently seeing your patients at the recommended intervals, taking regular x-rays, but despite all efforts, some patients continue to experience bone loss. And here's the thing, without proper diagnosis and a course of action, you're not only missing on the chance to treat a destructive disease, but also putting yourself at a legal liability. So did you know that the most common reason for a lawsuit against dentists is the failure to diagnose periodontal disease? So just for you to know, these cases settle anywhere from $125,000 to over $400,000. So it's a big chunk of change. There's a substantial blow to your bottom line here and also your reputation. So in my last email, I shared a quick video on diagnosis. So if you haven't watched it yet, I highly recommend checking it out. But today I want to dive deeper. So when you're facing a lawsuit about missing periodontal disease diagnosis, most cases will settle and the costs are significant, but let's not dwell on that. I want every piece of content I share with you to be helpful and actionable. So here's the first piece of advice. When you see bone loss on a radiograph, don't dismiss it as aging, as wear and tear or normal. The periodontium does not age. Communicate the fact about bone loss to your patient and start exploring the reasons for why this is happening. The sooner you start, the sooner you can help. Don't wait for severe bone loss to occur for tooth mobility to happen or tooth loss. Be an excellent diagnostician and a well-rounded dentist. I want to illustrate this with a case. Here are two radiographs of a young patient in her mid-20s with initial bone loss on number 14 and number 30. So take a moment to see that the bone levels are abnormal. I diagnosed this as localized stage 1 periodontitis, grade C. And how to diagnose, I explained very clearly in the previous video on diagnosis. So you might want to go back and check it out. Now, when you have slight bone loss, you need to alert your patient, number one, then document it. In this case, I increased the cleaning intervals to every 3 months and started with some localized SRPs with local anesthesia. And the idea is to debride, remove the retained calculus, and follow up after 3 to 6 months. In some situations, the bone can even come back after non-surgical treatment, believe it or not, it does happen. But here's what happened with this patient. She disappeared. She didn't get regular cleanings. She switched to another dentist. Fast forward 4 years, and the radiographs now show how the bone loss has progressed. It got way worse. So at this point, SRP would be like putting a Band-Aid on a broken arm. Okay, it's not going to help. It's time for a periodontal procedure to debride the bone defects, refresh the root surfaces, and apply a regenerative technique. If you frequently encounter cases like this in your practice, or you're not 100% sure about the course of action, pay attention to the upcoming emails and our live training this month. These cases exist in your practice right now. Patients are coming back without symptoms, worsening bone loss visible on radiographs, and are not getting the care. So if you have these cases in your practice, email me back with similar cases that may be puzzling you, that you're not sure what to do with. My goal is to teach you how to catch these defects early on in the game, because early diagnosis means early treatment. My goal is to teach you how to catch these defects early on in the game, diagnose them, and treat them. This is a growth opportunity for your practice, and it will establish your reputation as a dentist who knows how to save teeth. Plus, it helps you avoid those legal liabilities with hundreds of thousands of dollars in losses. I hope this video was helpful to you. Check out the next email and video about other periodontal issues that you can address in your practice. This is Dr. Ziv Simon, and we'll see you in the next one.